Good afternoon, everybody. My name is Teresa Castro, and I'm a proud alumna and staff member in UNC's Office of Alumni Relations. Thank you all for joining us today for the Alumni Career Panel, Alumni in Nursing. Today, we will learn from and connect with fellow UNC Bears working in a variety of roles within the profession of nursing. First, this event will be recorded and will be available on demand a week after today on the alumni website. I will post the link in the chat. I invite you all to start building your network and reach out to all of our panelists after this event. I will post their contact information in the chat toward the end of this virtual event. And 3, I will go off screen after introductions and will return towards the end of the event to provide a closing statement. As we highlight the careers of these alumni, I invite students, fellow staff, and faculty to ask questions via the Q&A feature. Now, please help me in welcoming our panelists. Panelists, please introduce yourself by stating your name, pronouns, title, the organization you work for, your UNC degree, and a little bit about yourself. And Rosemary, we'll start with you.
Hello, everybody. My name is Rosemary Gonzalez. I graduated UNC in summer of 2023 with a bachelor's degree in nursing. I currently work as a registered nurse at the UC Health here in Longs Peak in Longmont, Colorado, and I work on the medical oncology floor.
Awesome. Thank you, Rosemary. And Liz, how about we go to you next?
My name is Liz Wise Kissel. I graduated from UNC in 1975 and 1982. A long career, very enjoyable. Presently retired, so have a lot of experience, but not currently working.
Thank you, Liz. And Kiana, why don't you close this out?
Hi, my name's Kiana Perez, and my pronouns are she, her, hers. I graduated with my bachelor's in 2021, and then my master's in nursing in 2023, and that was with leadership, quality, and safety. Currently, I am a part-time faculty clinical instructor at Ames Community College, and then I also am a registered nurse at the CSU Health Network Center in their sexuality and reproductive care.
Thank you, Kiana. And now I will hand it over to Anissa to introduce herself, and then she will be our facilitator this afternoon. Anissa. Unmute yourself first.
Hi, thanks so much. I apologize. I have like double mute today on my computer, apparently. My name is Dr. Anissa Guzman, and I am a UNC graduate from 1993 and 2001. I have a bachelor's degree in nursing from the University of Northern Colorado, and then earned my MS, Master of Science in Nursing Education. And I was the last cohort that was also a clinical nurse specialist program. So I'm a CNS of chronic illness. I also have a PhD from the University of Colorado and an executive MBA from Creighton University. Pronouns are she, her, hers. I am currently an associate director of adult health inpatient unit with Banner Health in Tucson, Arizona. So I think that's kind of a little bit about me, and then I will jump right in and get us started on questions. So panel, I will start with the question, and then I will ask several of you to answer, and that will be how it goes. Sound good?
Sounds good.
All right, great. So the first question we have for you is, how did your UNC experience help you launch into your career and arrive at your current role? Rosemary, will you start for us, please?
Absolutely. So I just graduated this past August, and I was super involved in my undergrad at UNC. And so I think this really played a big role in allowing me to make these, what I hope will be lifelong connections with a lot of my classmates that I still interact with, a lot of my instructors who are now mentors, to kind of help guide me in the right direction. I think the UNC program is so rigorous, but also so supportive compared to word from a lot of other programs. And so it was really nice to have that support from faculty, and also people who even weren't in the nursing program were just there for me a lot of the times when I was really stressed. And so the connections that I formed, I think, made a big of a difference.
Thank you, Rosemary. How about Kiana?
Yeah, so before entering the nursing program at UNC, I was lucky enough to have many individuals that I connected with that had at least already gone through the program or were currently in it, just to kind of get some background and kind of learn more about the program. At my time at UNC, I was able to, be pretty involved on campus as well. I worked part-time at the bookstore, which helped me really kind of stay connected to the community. And then with each passing semester, I always tried to make sure that I stayed in connection with my professors and preceptors. So always trying to exchange information to make sure that I'm staying in connection and kind of working, networking and being able to call on them down the road when I had questions.
Great. Thank you, Kiana. And Liz, can you finish us up for this question, please?
Well, it's really a nice way to end it because I would ditto what both of them said. Considering I graduated in almost 50 years ago, the UNC program is still the same. I felt the same way. Very solid education, great faculty, and the involvement at that time too with student organizations, with as they said, with their peers and with faculty. I think that's what's really strong about UNC, and obviously it's the same way for these graduates from the 2020s.
Great. Thank you so much, Liz and Rosemary and Kiana. For our next question, advocacy is an essential aspect of nursing practice. Can you share examples of advocacy work you've been involved in, whether for patients, the nursing profession, or healthcare policy? How do you see advocacy continuing to shape the future of nursing? Liz, would you start this one for us, please?
Sure. I really think that advocacy is something that I've done, and I think all of the RNs do. Every patient, you're an advocate for them, where they are, for what their needs are. You speak up. I should say me, speak up and advocate for them. Do they need resources? Are they ready to go home? Do they need things that we hadn't thought of? I think as nurses, we are there for the patients. We advocate with every interaction. Specifically, I did the same thing when you speak up, when you question an order from a physician and you think that this isn't right. You take the step forward to say, can you help me understand what this is? And you advocate for the patient to make sure that that's correct order. You do that in management. Also, what I have done is I worked with Division of Medicare in developing policies and being on one of the first panels for developing standards of practice.
Thank you so much, Liz, for that information and insight. I appreciate it. Kiana, or I'm sorry, yes, Kiana, would you take, what is your view on this question?
Yeah, so mirroring a lot of what you mentioned, Liz, advocacy is a foundational aspect in the nursing field. And so many times nurses are the people that are working most closely with the patients. And so it's really important that nurses are able to advocate and speak on the wishes and the needs of the patients. And so sometimes it's having those hard conversations and bringing to light the topics surrounding health that many may choose to ignore or that may be forgotten. I think it's a really foundational value of the nursing profession. And it can be presented in a variety of different ways. During my time as a school nurse, I really took charge in advocating for the students and the medical and healthcare needs within the classroom and testing environment to make sure that their needs are being met, but also that they're getting all of these same opportunities as their classmates. And so it can be touching on not only their physical needs, but also their mental and spiritual needs as well.
Thank you, Kiana. Rosemary, we've talked a lot about patient advocacy. I'm wondering if in your current role, if you see advocacy any differently than that, or if there's any other examples that you have that nursing does, or how we might utilize that for the future of nursing also.
I think that Liz and Kiana did a great job at kind of explaining what the aspect of nursing really is. I mean, patients who are in the hospital really do require that 24-hour care, and nurses are the one that are at the bedside, making sure that are they sleeping? Are they eating? What are the changes that they're going through every day? Listening to their concerns, educating them properly, and really just promoting the best culture possible within their situations. What was the last part of your question about how it shapes in the future?
How it could continue to shape the future of nursing.
So I think that in the hospital, we see so many different cultures, and really learning that patients can want very different things, and learning to respect that, even though you don't have the same views, is something that is super important.
Thank you, Rosemary. That is very important to consider also. When I think about advocacy, the other thing I would add here is advocacy overall for the profession. And one way I think that we have opportunity in doing that is in engaging with professional organizations like the American Nurses Association, or I identify as Latina, and I am currently starting a chapter in Tucson for the National Association of Hispanic Nurses. We don't have a chapter here, so we're getting that going. I think that's a way that nurses can really get involved in working to advocate not just for our patients, their families, but also for the overall discipline or profession. And so I would really share that. And I think it's an opportunity that I think sometimes we maybe early in our careers may not feel like we could really contribute much, or is it something that you really want to do? And I would share here that I think it's another good way that we can advocate for nursing overall, particular or specific populations, and also for our patients and families through that work too. So I would just add that component. Our next question, Kiana, we're going to start with you on this one. Nursing offers various career paths, including clinical practice, education, management, and research. Can you discuss the different roles you have pursued in nursing and what inspired you to choose your specific path?
Yes. So in my last semester of nursing school, I did my senior practicum on the labor and delivery floor. It was a interest that I had going throughout my entire nursing career. And it was definitely something that I wanted to take the opportunity to explore before I was out on my own in the nursing field. Going through nursing school and even before, I always did have a passion for working with kiddos. And so when I graduated, I decided to pursue pediatrics, and that was through the outpatient setting. So it wasn't in the hospital, but it was clinic based, where I was seeing children ages newborn to about 21 years old. And this job was really fulfilling. Again, I had a huge passion for working with kids. And through pediatrics, you also have to be pretty strong in catering to the whole family and making sure that, everyone is on the same page there. And so after I spent some time in pediatrics, I found a way to kind of pair pediatrics and then also my new up and coming interest in community health, and how I'm able to connect, families to resources and work with the whole family unit. And so that is where I started my time as a school nurse. And so that was very rewarding. I kind of felt like I had, the best of both worlds. And that's the kind of nice thing about nursing, is that there are a variety of specialties that you can pursue, and it's okay that those may change over time as far as what you want to pursue. And so I spent my time as a school nurse, and then currently I decided to pursue a interest in working with higher education and college students. And so that's where I'm located now at CSU in their Sexual and Reproductive Health Center. And so I think it's a really fulfilling job to be able to eliminate a lot of the stigmas and stereotypes that may be surrounding, this very vulnerable side of healthcare. And so I'm also able to, provide a judgment-free zone and kind of meet the needs of students in that way. And then, as I mentioned in my intro, about a year ago, I decided to pursue my clinical instructor position with Ames, and that is part-time. And so it's really awesome to be able to pursue that in addition to my full-time job. And this is where I'm going into the hospital settings with nursing students that are going through the program. And I'm able to kind of serve as a mentor for them. I'm able to kind of evaluate where they are and check them off on various skills. And it's been really awesome to both educate these students, but also empower them to be confident as they are nearing, the end of their schooling, and they're going to be nurses here soon. So that's kind of my journey through nursing and how I've kind of been able to explore different passions that I've had. So, yeah.
Thanks, Kiana. I appreciate that. You're very busy and doing a lot already in your career. Liz, how about you? Can you discuss the different roles you've pursued in nursing and what has inspired you to choose that specific path?
As Kiana just noted, a lot of times what you start off thinking that you want to do, it's changed through experiences. In 42 years of practice, I have had various jobs from bedside nursing to management and to home health care. I started off as a nurse in the Colorado Migrant Program in Sterling. I worked at UCLA on their medical neurology floor, public health nursing. When I was doing public health, then as Kiana noted, you work with students, and that's what inspired me to go ahead and pursue my master's at that time in nursing education with a clinical emphasis in gerontology. And so going that route, I was a faculty. I enjoyed, that was probably being a clinical faculty with students and seeing the lights go on and the ahas. It was that was probably the most rewarding part of my career. I worked at Fitzsimmons Army Medical Center as a quality assurance risk management. I've worked at the Division of Medicare. I was a clinic nurse in one of Denver Health's clinics in North Denver, and then became the program manager. I think it nursing allows you so many opportunities to venture out, find your niche, and sometimes, as Kiana said, your niches change. I think it's just definitely rewarding for all the experiences I've had.
Thanks, Liz. I agree with that 100%. I think one of the most beautiful things about nursing is that I think you can avoid burnout by being open to other possibilities. And nursing is full of opportunity in all the different specialties that you can do in inpatient care. There's outpatient care, public health, school nursing. There are academics, lots of things to do. I think for me, along my career path, as I reflect on the 30 years I've been doing it, really two things stand out for me. I am committed to lifelong learning. So it really, you can clearly see that. As I said, I have a lot of different degrees. That's really how I have pursued sort of advancing my career and my opportunities. Also, I think along the path for me, empowerment has played a very, very big part in helping me to make decisions for my own career and also in mentoring or supporting others along their career path. Like the two of you, I was in academics as well, and I really liked teaching a lot. However, I really love leadership. I feel like a lot of the things I've done, make the point to the team that I support now as bedside nurses that they are leaders every day as registered nurses, leading the care of their patients, leading the team of PCAs or other nurses they're working with. And for me, that was a really big connection, finding my joy and fulfillment through leading different teams. And I think that's one of the things that has inspired me along the path to sort of try some other things in leadership. And like I said, being willing to open to opportunity because they certainly come along for sure. Our next question, Rosemary, we're going to start with you. Networking is essential in the nursing profession. Can you share insights into how you strategically built and leveraged your network to open doors and create opportunities in your career? What advice do you have for students on effective networking?
Absolutely. So as I mentioned before, I was involved in a lot of programs at UNC. And so I have plenty of connections with former classmates, friends that I still talk to, former teachers and clinical preceptors. I think it's important to step out of your comfort zone and form these connections as a student. It's important to realize that everybody has their strengths and weaknesses. And if everybody can bring something to the table, you want to be at that table. You want to be at that table where everybody has different input that you can grasp. And so, yeah.
Thanks, Rosemary. Liz, what would you add to this? What advice do you have for students on effective networking?
I think Kiana had just, or Rosemary had just mentioned that as far as the students staying connected, it's the same thing as you're in your professional life throughout your career. You stay connected with other professional RNs, healthcare providers. There's many, you always can learn. You can share information. You can learn. And I think that's what networking, either in small groups or in your professional organizations, whatever they are, don't get outside the box is what you need to do, is step out there, learn things, put yourself out there, introduce yourself, just be open to new opportunities. And probably one advice is don't burn bridges. You never know when those people that you've had contact with, you might have them at a future time in a different place.
Thanks, Liz. I think that is a very good point. Nursing is actually a very small world. You will see people all over the place, or they'll know people that you know, for sure. Kiana, how about you? Can you share any insights into how you strategically built and leveraged your network to open doors and create opportunities in your career?
Yes. So I think we're all very lucky now to have, social media and the internet as a platform to really boost and um, you know, network in a greater span. And so using platforms like LinkedIn is a great way to add, your current and former professors, your mentors, classmates, and coworkers. As many of you mentioned, you never know when in your time as a nurse, your worlds may overlap again. And so it's really a great platform to be able to keep up on what others are doing within the nursing profession, and what passions you may share and what endeavors you may be able to collaborate on. In these new environments, whether you're thinking about going into the nursing profession and starting nursing school, or currently in nursing school, in these new environments where you're, at a new facility for your clinical day, always try to extend yourself. And as we mentioned, to exchange information, whether that's, phone numbers or emails, to be able to stay in touch, and be able to, reach out to someone when you need more information, when you're interested in something. I think it will really benefit you as you go further into your career, to be able to have many people that you can call on. And as Liz mentioned, always just making sure that you're practicing professionalism in every career endeavor that you have, because your paths may cross again, and you always want to keep those lines of communication positive and open.
Thanks, Kiana. I would add here, as I mentioned previously, professional organizations getting involved in local chapters. You can make a lot of connections in cross organizations. So in my area, the example I would give is there's about 5 or 6 other acute care hospitals in town. And so I would say getting involved in organizations allows you to connect with people at other places for sure. Conferences, if you can go to even a local or regional conference, sitting next to people you don't know and stepping outside that comfort zone and introducing yourself and talking a little bit about what you do and what they do helps to also build effective networks. And then the last thing I would say, and I have had the opportunity to interview for a number of different jobs, and sometimes the job just wasn't the right fit for me, but I was able to connect with the person who was the leader that interviewed me and took a chance and just said, hey, I really felt comfortable with you. I'd love to stay connected. Is that okay? And that has really been effective for me also. So I would encourage the same thing. Nursing can be a demanding and challenging profession. Can you share a significant challenge you faced during your nursing career and how did you overcome it? How would you advise students to approach and learn from similar challenges in their future careers in the nursing profession? And Kiana, we'll start with you. And while you're speaking, Kiana, it looks like we have a question, so I'm going to open that up and then we'll take a look at that too. But go ahead, Kiana.
Okay, so within my nursing career, I think delegation has been a challenge that I've had to kind of work through as time has gone on. Delegation is the process of a nurse directing another individual to perform, nursing and non-nursing tasks, and ensuring that it's within the other individual's scope of practice and that it can be done safely. So this may be to other nurses, medical assistants, or a variety of other healthcare staff. And it's definitely a skill that you, as I mentioned, you will perfect over the course of your career. And it can sometimes be a little uncomfortable. Um, you know, Throughout my nursing career, I've had instances where maybe my delegation isn't always accepted with ease. And so I think it's always important to really establish those strong, connections. And when you do run into these challenges where you're trying to kind of work within, your respective scopes, to have those conversations about, what feelings they may be having, what past experiences that may be affecting their current practice. I think it's always important to be empathetic to the other individual and kind of, their background, but always as a nurse to be able to show that you're a team player and that you're never too good to complete any task and that you're always willing to jump in when needed. I think that will go a really long way because at the end of the day, as a healthcare team, you're all working towards the greater goal of improving a patient's health and well-being. And so if you can have that conversation surrounding your shared goals and how you can improve your relationship and how it can be a positive one, I think that'll be really beneficial to your careers going forward. So yeah.
Thanks, Kiana. Liz, can you share a significant challenge you faced during your nursing career and how you overcame it?
Sure. I have a couple of them. One, when I was in the public health department, we did home health care. So we would go out, see the patient. As RNs, there were assessments that we did. There were the home health aides would provide some of the care like meal planning, preparation, the care of the home. At that time, the county commissioners were concerned about the cost. And so they had an organization come and decide, not with a whole lot of nursing input, what the time would be to do a nursing assessment? What would be the time that would be acceptable to clean someone's home, to prepare a meal? And it was very constricting. They obviously did not understand that there's more to nursing and home health care than just doing things. A number of our patients would welcome us with a cup of coffee and some cookies, so they would expect us to sit and visit. That the, I guess I'd call them timers, didn't put into the whole time. So there was a lot of conflict, and we finally, as a group of RNs, put forward our concerns and invited the timers to come out and see what a real visit is like, and that there's more to it than just tasks, that the provision of care is that care and communication with the patients. So it took some finagling and some discussion, and they ended up saying, okay, you're right, we can't time all this. So that was huge for that. One other one is really on an individual patient. I remember this woman who had wounds, weeping wounds on her legs. We needed to do the dressing changes. Well, I went to do the first dressing change, and in her kitchen there was a little cord across her room that had all of the dressings hung up because she had washed and bleached all of the gauze that we had put on her wounds. And she was from the Depression era. She did not want to waste. So I had to figure out a compromise. That was a challenge. It's like, how do I do this and keep the wound clean? So the compromise that the woman and I came to was I would put brand new clean ones on the wounds, and we would use her other ones around the outside. It seems trivial, but that is a challenge when you're working with patients and being able to connect with them and gain their trust and their acceptance of the care that we needed to provide.
Thanks, Liz. Those were two great examples. And then Rosemary, do you have a challenge that you could share and tell us about how you overcame it?
Yeah, so I have only been a practicing nurse for I think about 2 months now, and so haven't faced super many things, but I think something that I personally have struggled with is non-compliant and angry patients that you kind of have to really be patient with and really redirect and educate them and remind them that you are both on the same page. You both want the same thing. And if you can meet them halfway and it's safe and it's right, then you will absolutely do that because you have one goal, and that's for them to get better. And so I think patience is really a virtue. Be patient with them and understand that they're not having the grand time either. And so really just build that rapport with them and listen to their concerns.
Thanks, Rosemary. That reminds me of something, currently in my job. Nursing is challenging, and as a leader, it's very, very challenging in different ways. I think what you're highlighting that I would want to be able to sort of share is, you are new, and I really appreciate that you're like, I haven't seen a whole lot, but I think that learning to communicate as you are doing, learning to not personalize challenges that patients are experiencing, which is really hard to do sometimes because we're doing our best, we're working really hard, and patients have their own challenges and things. I think there's a great little video out there. I think like Cleveland Clinic or someone made it, and many others have copied it, but it's, people walking down the hall, or they're in a wheelchair, or they're in the elevator at the hospital, and it just is a little blurb above what, they lost their husband, or they're being evicted. And I really try with my team, between the peer-to-peer, across disciplines, nurses to patients, and just to remind them it's not personal. They don't know you in that way. They're having a really difficult time, and if you can step back and remove yourself from that, that can be really helpful. I think again, some of the things I would advise students to approach, right? Remember, you can escalate. If there's a problem, there is a chain of command. Take it to your preceptor if you're orienting, take it to your charge nurse, take it to the director or the manager of that unit, and even to the house supervisor if that's the structure that you have in your organization. So I think remembering that you're not alone, which it can feel like that sometimes when you're being faced with some really difficult challenges, but that the beauty of nursing too, one of the other beauties is that it is a strong network and there are a lot of people who want to help you. So I would just keep that in mind as well. So Rosemary, the question in the chat is for you. So I'm going to just kind of take us back for a minute so we can address this question from someone in the audience. You mentioned the diversity of cultures you encounter at the hospital. I'm curious if any one of you can share how your approach to patient care changes when working with women from communities that have historically faced challenges in the healthcare system. Is there anything you do differently to build trust and ensure they feel heard and understood? So Rosemary, we'll start with you because you were the one who kind of spoke very eloquently about that. So then, and then anyone else, Kiana, we can go to you next if that sounds okay.
Yeah, I think in terms of approaching the patient, if I can relate to them in any way, then I will. Like I said in the last question, I think it's important to build that rapport with the patient and build trust. And so an example I think would be with patients that don't speak English very well. In my experience, when I was small and I would go with my mom to her doctor's appointments, she'd kind of nod at the doctor and look at me and say, "What did he say?" And so really making sure that they're understanding. And if I need to bring in that screen with the medical interpreter to make them understand what I'm trying to say, even if I have to do that and tell them that it's not a bother to me, that I want to make sure that they're heard, I want to answer any of their questions. And so I think that historically, a lot of people who don't understand doctors and their medical jargon just kind of go along and don't really understand what they're saying. And so I think that making sure that they feel safe in that situation, safe enough to ask the uncomfortable questions.
That's really great. That's a really great point, Rosemary. And I think really at the base of what you're saying, building trust, establishing rapport, helping them gain confidence. And just like you said, doing that through checking in and making sure that you're following up when you say you will. I think that's half the battle. If you maintain that close contact and make sure that, I think using keywords or scripting right, that include things like, I want to make sure I hear your story. I want to hear you. I want to hear all the details. I have time. Things like that are important. Kiana, would you add anything to this point or to this question?
Yeah, as you mentioned, Rosemary, I think it takes a great amount of awareness as the nurse to be able to approach, patients from different backgrounds and how their experience may differ, despite it being the same situation as, your previous patient. I think it's always important to, establish where they're at and their foundational knowledge, because sometimes it's as simple as explaining what a disease process is or why a medication is given rather than just jumping into the regimen and how it's going to help them. It's really sometimes starting from square one. And as a nurse, you have access to all of these amazing resources, whether it be in inpatient or outpatient community health. You have the resources that these patients, may need. And so it really is on you to be able to connect them to the proper people so that way they can get the best care that they, deserve. It's important to know that there are a lot of stigmas and historical traumas that run deep. And so always making sure you're, extremely aware of where they're coming from, assessing both the, the physical things that you're seeing, what they're telling you, and just always ensuring understanding, I think, is really the most important part of, our care.
Thanks, Kiana. I think I'll go ahead and move on to the next question. And Liz, we're going to start with you on this one. Nursing offers numerous opportunities for professional growth and development. Can you discuss any continuing education, certifications, or specialized training you've pursued to enhance your nursing skills and knowledge?
I think I don't have any specific certifications, but I think all of us would agree that nursing is a lifelong learning process. And there are conferences I've attended. I've also presented at conferences. Just listening, being aware of what is currently out there, being up with current research, with current nursing practices. What I have found in working with students is that I learn a lot from students, is that students bring to clinicals their current information, current knowledge, what they're learning in the classroom. It has many times broadened my nursing background as well by listening to students. So that is one way, but I think you continue to learn throughout your career. Also learning from your colleagues, be they physicians or physical therapists, all the different disciplines, you can learn something from them daily. I think that's a big thing, is to remember we are all in the patient care arena, and that is where we can all learn from each other and share, not only learn from, but share with your colleagues.
Thank you, Liz. How about Kiana? What would you say in response to that question?
Yeah, so depending on your specialty, there are a variety of continuing education courses. They're usually standardized like about an hour long, where you can obtain and join seminars. Sometimes they're conferences. In the specific specialty that you're in. So these continuing education courses just help you enhance your knowledge of the specialty that you've chosen, to make sure that you're staying, up to date on the best practices, making sure that you're serving patients in the best way possible. Something great about nursing is that, also when you're going into any specialty, a lot of times, if there is a specific certification or license that you need to obtain, many times that employer will help you obtain that, and give you the tools to do so. So when I pursued my clinical instructor position, they helped me obtain my career and technical education license. And so it's just things to make sure that you're, providing safe care and knowledge to your patients.
Thanks, Kiana. So I'll add to this one too. My specialty in leadership, I spent 6 years as a director of clinical education, professional development, professional practice, and clinical excellence and research. So I think one of the most important things or words of advice that I would give is to look for employment in a location that offers support, as Kiana and Liz mentioned, around professional development. Do they have like leadership academies or charge nurse academies? Do they have nursing grand rounds or physician grand rounds where nursing can participate and you can earn continuing education? Arizona does not have a requirement to have continuing ed to renew your license, and I don't believe Colorado does either. I was licensed there for a very long time, but there are some states that do require that, and so those things can be helpful. As I said, I'm a lifelong learner. I've done lots of different leadership assessments and personality assessments, and learner is number one on my Strength Finders assessment. And so if I want to, if I'm taking something new on, I'm gonna go to, advance my education in that area. I have advanced degrees in nursing, business, and business, and I think that those are things that for me made sense. There are locations that will support tuition reimbursement so that you can get a return from the organization you work for as long as you commit to an additional year of work for them, or different. It varies from location to location, but generally it's about a year for a year, I would say, on average. As For me, also not just formal degrees, but I also have a nursing certification, and I would highly encourage or strongly encourage nurses, new nurses or experienced nurses to pursue specialty certifications. Generally, you need a certain number of hours to do that. It's usually about a year at least of experience. So, Rosemary, I would encourage you to do that after the end of your first year. And Kiana, I would imagine you're um, ready to do, for instance, nursing professional development or certified nurse educator. There's even a certified clinical educator certification. So I hold certifications in nursing professional development, and I'm a certified nurse educator. And I also have the I have two more, sorry, nurse executive advanced board certified. So it's a leadership one. And then also the certification for professionals in healthcare quality. And those make sense to me because of the kinds of work that I do, and have done in the past. So I would say all of those things give you some leverage in your position. They also demonstrate it's a mark of excellence that you have the skill and the knowledge to be able to pass that certification exam. So I would encourage all of nursing to take a look at that. And also a lot of organizations, as Kiana mentioned, will pay for it. So you might have to pay out of pocket in some locations, and then they reimburse you. And other organizations have a program where they'll pay for it the first time, and if you don't pass it the first time, then you'll have to pay for it the second time. So there are some good programs out there. And I think we're to our last question. So we have about probably 7 minutes left here. And this one will start with Rosemary. Can you provide a final word of advice for UNC Bears currently seeking a career in the field of nursing?
Yes, I think it's really important to schedule time for yourself to study and really grasp the material. My current coworkers tell me that nursing school teaches you how to pass the NCLEX. It teaches you all the good sciencey things, and your career will teach you how to be a nurse. And so having that base foundation and knowledge of all the diagnosis and symptoms that you can catch in your job is super important, but also giving yourself grace. The program is very hard. You're going to be at clinicals. You might not be able to party like your other friends, but just give yourself grace and time, and understand that, just like Liz and Kiana said, you will always be learning. And so if you can't grasp something at the moment, you will grasp it later.
Thanks, Rosemary. Liz, what would you offer as a final word of advice?
I think it's combining all of what all of us have said, is learning, fulfilling your passion for caring for the patient. That's probably one thing, is don't forget the patient between the sheets. Is a lot of times technology and all of the whistles and bells and all that get priority sometimes, but I would say that that's the importance of nursing is our caring for the patient and their families. There's many, many opportunities, as you've heard all of us say, so many different jobs that we've had, so many different career paths, and there's much more out there for the students of today. So I just encourage you to hang in there. And as Rosemary said, not always easy, but it's very fulfilling and very rewarding.
Thanks, Liz. Kiana, what final word of advice would you have?
Really just mirroring again what everyone has reiterated, to really be kind to yourself. Nursing is and can be a very selfless job at times, and a lot of times we feel like we're giving everything, and you really just have to prioritize yourself as well. You can't take care of others if you don't take care of yourself. know that it's okay to try something and not end up liking it and change your mind many, many times. The world of nursing is very wide, and there's definitely something out there for you if it's a passion.
Thanks, Keith. Advice, just sort of, I think summarizing for all of us, and to add that nursing is a sacred discipline, and that when you are making the choice to become a nurse, that you are really entering the sacred space of remembering that you're there for the patient, you're in their space. You cannot care for others if you don't care for yourself first. And so I think that as you pursue the career, that you remember those things that Rosemary, Kiana, Liz, and myself have shared with you today. And I will turn it over to Teresa. Thank you so much.
Thank you so much, Anissa, for moderating this panel, and thank you to our panelists and everyone for joining us today. It is always an honor and a pleasure to host fellow Bears and hear about their UNC experience, their unique identities, career paths, and industry insights. Throughout the semester, we will be hosting virtual alumni career panels, and to learn more, you can visit www.unco.edu/alumni/careers. And before we end tonight's event, we have a colleague over from UNC Center for Career Readiness who will share some insight and resources that they have.
Thank you, Teresa. Hi, everyone. My name is Jessica Espinosa. I use she, her pronouns. I graduated from UNC in 2016 with my bachelor's and 2018 with my master's, and I am now a career counselor at UNC Center for Career Readiness. Here at the Center for Career Readiness, we are here to support you with all things career while you're here on campus as a student, as well as up to 3 years after graduation. Our office, connects UNC Bears to quality on-campus community and national employers through the Career Tool Handshake and through hosting on-campus career fairs each semester. Students are encouraged to schedule an appointment with our career counseling team for resume and cover letter reviews, job, internship, and grad school search support, mock interviews, networking tips, and more. We offer drop-in hours, both in person and virtually, as well as workshops throughout the semester. For further information on all of this, you can visit our website at unco.edu/career, and you're also welcome to email us at career.readiness@unco.edu.
Thank you so much, Jessica. And if we can have everybody unmute themselves, we're going to do a quick Go Bears on a count of 3. And 1, 2, 3. Go
Go
Bears!
Bears!
Have a great evening.
Thank
Bye.
you.
Bye.